The reality is that on a macro level, the NHS is performing very badly. The current waiting list problem in A&E departments has a long history. We've had decades worth of shrinkage in bed capacity. We have a workforce crisis, so the doctors and nurses simply aren't available to see patients quick enough. We know from studies that have been done that for every 80 patients waiting more than 12 hours to get a bed, there is one preventable death. Now, if you scale that up to the 60,000 plus who are waiting more than 12 hours, that is literally hundreds of people dying preventably because they're being looked after in corridors. So we've had over the decades a political consensus of stealth privatisation. They have created an environment within which these private providers can move in. So it would be very difficult to privatise a well-functioning, a low waiting list service, because the public would be very happy with it. They'd be very angry about any attempts to privatise. So the government has to relatively defund the NHS. So not only is this an embarrassment internationally, other countries are looking at us in disgust really with what our patients are going through, but it's a tragedy for patients who have to wait long hours in corridors, some of them putting their lives at risk when they've paid taxes all their lives, and they should expect a better quality of service. So there has been absolutely no real change in the direction of travel with the change in government. The Labour Party have been in negotiations with people like BlackRock, and what they want is a health service such as the NHS to be carved up so that there are more potentials for investment for them. And the current Labour administration has pulled back people such as Alan Milburn, who has a record of NHS privatisation under the Blair-Brown administration.